Hi everyone, welcome back to Dr. Rohini's Sthree. Today let us try to discuss about the risk of endometrial cancer in patients with PCOD. Yes, there is increased risk of endometrial cancer in patients with PCOD. When compared to patients who doesn't have PCOD, patients with PCOD has 3 times increased risk of endometrial hyperplasia and endometrial cancer. So let us try to understand what is the reason for this. As we all know, the periods in patients with PCOD is irregular because there is no release of egg or ovulation every month. The periods are irregular and the periods are anovulatory. It means there is no release of the egg. So what happens? Because there is no release of the egg, there is no formation of the corpus luteum and there is no secretion of the hormone called as progesterone. This hormone, progesterone, is a protective hormone against the development of endometrial cancer. Since there is no secretion of progesterone in patients with PCOD, the unopposed action of the hormone estrogen continues. So the periods which they get, that irregular periods which happens once every 2 months or once every 3 months, is called happens because of the breakthrough bleeding. So because of the effect of estrogen, the endometrial thickness keeps on building up and it increases to such a level that it cannot hold it anymore. And then once the endometrial breaks down, it comes out as periods, but it is anovulatory bleeding, and this we call this as breakthrough bleeding. So because of the unopposed action of estrogen, there is increased risk of endometrial cancer in patients with PCOD. Apart from this unopposed action of estrogen, also the patients with PCOD have high risk of obesity, high risk of diabetes, high risk of hyperlipidemia. So all these factors also increases the risk of endometrial cancer in patients with PCOD. So what are the measures or protective measures we can take to reduce the risk of endometrial cancer in patients with PCOD? The first and foremost thing is, already once you're diagnosed with PCOD, you know that you are PCOD for the rest of your life. So what you have, especially when you're not planning for any pregnancy, what you have to do is, if you don't have to wait for 3 months or 4 months or 6 months to get your period spontaneously. So what you have to do is, once every 1.5 months or 2 months, you can take exogenous progesterone tablets for 10 days or 15 days, and after stopping those tablets, you get your periods. So what happens, it even regularizes your periods, and also it gives the protective effect of the progesterone hormone on the endometrium. So this reduces the risk of endometrial cancer. But if you're planning for a pregnancy, that's a different story, and that's a different treatment, and that I can talk about it in my videos in future. If you have completed your family, if you're already having 2 or 3 children and you're not planning for pregnancy anymore, what you can do is, you can have, instead of taking tablets every month, you can go for hormonal intrauterine contraceptive device which contains progesterone hormone. So it gives a continuous it continuously releases this progesterone hormone into the uterus, and that will have a protective effect against the endometrial cancer. So these are the 2 things which you can do, and definitely the other measures are losing weight if you're obese. So, and also, how can you screen yourself? There are no guidelines or fixed rules to say that you have to do this screening regularly. But if you want to do, you can do an ultrasound, and in the ultrasound we check what is called as endometrial thickness. If the endometrial thickness is less than 7 mm, then the risk of having endometrial cancer is very less. And also, you can if you have heavy bleeding, even after taking these measures, you can go for what is called as endometrial biopsy. What they do in that is, they take a endometrial tissue, they sample the endometrial tissue, and we send it for the test, and which confirms whether your risk for endometrial cancer is more or not. So that will be confirmed by the biopsy of the endometrial tissue. So these are the measures which you should take to reduce the risk of endometrial cancer in PCOD patients. I think for today this is enough. Will come with more information in my next video. Till then, take care. Bye. If you like these videos, please like, comment and share. And for more updates on women's health, please subscribe to my channel and don't forget to press the notification bell.